Hi, everyone. My name is Kayla Evans, and I am the CHAMPS Programs Coordinator for Health Center Workforce, and I'll be your moderator for today's event. Welcome to this year's Understanding and Utilizing Statistics from the CHAMPS 2024 Salary Survey Project webinar. Today's event is being recorded for future reference. Community Health Association of Mountain Plains States is your Region 8 primary care association, and this year, CHAMPS is celebrating 40 years of providing essential training and support services to our health centers. Today's event will be presented by Andrea Martin, CHAMPS's Workforce Development and Member Services Director. All participants are in listen-only mode, so questions should be submitted using the chat or the Q&A feature at the bottom of your screen. Feel free to submit your questions at any time, and we'll do our best to answer them all by the end of the event. If you need technical assistance at any time during the event, please reach out to Haley using the chat feature. She's identified as CHAMPS Tech Lead, and she'll help you out as soon as possible. Please note that if you're having visual issues during the event, you might try pushing F5 to refresh your screen. If that doesn't work, you could try using a different internet browser. All right, so to better understand our audience, we will be asking for your input throughout the presentation. So we're going to have our first interactive poll to practice. So you should now see an interactive version of this question pop up on your screen. Please select the most appropriate answer and then click submit. I'll give everyone a few seconds to choose their answers, and then we'll close the results. All right, I think let's close the poll and see the results. Great, so how many FTEs does your health center employ? So half of you employ 80 to 250, and then the other half is more than 250. Great, thank you for participating. Now, I am pleased to introduce today's speaker, Andrea Martin from CHAMPS.
Great. Thank you so much, Kayla. Sorry for the delay there. My mute button was missing, but I found it. So great. I'm so happy to be here with you all today. I'm going to go ahead and kick off our main portion of our webinar by reviewing some of the learning objectives we have for you. So each time we publish this region-wide salary data, we want to be sure that you all know where the data comes from and how the survey process works. So at least a little bit about the design, the collection, the processing, the analysis of the data, and how we attempt to minimize errors as much as possible. We want you to know what changes there have been since the last time we published this data, and we want you to understand some of the tips and tricks for looking at the data and understanding some of the things that impact any salary data you happen to be looking at. So there is way too much actual data to overview it all in today's event, but we will be looking at some trends that stood out to us as we were looking at all of this data from the 2024 year. So let's talk first about why CHAMPS undertakes this salary and publishes these reports. Why do we do this, right? So we have two big overarching goals. We want to provide market data. So crafting salary structures is a pretty complicated process for you all. And most of you look at multiple sources of data and take multiple factors into consideration. So this project provides not only health center specific data, but also some breakdowns to highlight factors that might be most important for your organization. We also want to identify workforce trends within our health centers. And then note that even though the official federal antitrust guidelines have recently been relaxed a bit, there's still scrutiny on information sharing. So CHAMPS acts as your third party for aggregating salary data, so you're not sharing it directly with one another. And then we keep all of the data confidential, including only reporting aggregated figures for titles with at least 5 data points. So next, I want to say a little bit about the project history and time frame. So our Colorado Primary Care Association partner, Colorado Community Health Network, has been collecting salary and benefits data from Colorado health centers since 1998. That's a really long time. In 20 2004, CHAMPS, with the assistance of all of the other Region 8 state primary care associations, began collecting similar data from the rest of the region every 2 years. And then the project grows and changes each time we do it. So the survey tool that our health centers use to report their data is distributed in the spring. CCHN works to collect the data from Colorado health centers, and CHAMPS works with all of the other Region 8 states, so Montana, North Dakota, South Dakota, Utah, and Wyoming. There are instructions that are sent out with the survey tool to ensure everyone is submitting the data the same way, and CHAMPS also broadcasts a screen share event walking the health centers through the instructions in the tool to help everyone understand how to submit data, the changes in the materials from the prior year, and things like that. So CHAMPS combines the data from Colorado with that from all of the other 5 Region 8 states. We upload it all into a database, and we begin quality checks and data analysis. Also, some of you may know that since 2008, CHAMPS often works with Northwest Regional Primary Care Association, or NWRPCA, to use the same tool to survey the health centers of Region 10. So that's Alaska, Idaho, Oregon, and Washington. And then there was a session at last year's fall CHAMPS NWRPCA conference that compared some of the Region 8 and Region 10 data. And then we also will often work with some of our other Region 8 states to analyze data on their own state level. So it just depends on that from state to state. So we do this data collection on this big survey every 2 years, typically the even years. And then twice we've done abbreviated surveys in the odd years. So we did it in 2023, and we are currently collecting data for the 2025 abbreviated survey. So what we're looking at today is the big survey. Includes a lot more data than the abbreviated version. So I'm not going to talk anymore about the abbreviated versions. I don't want to confuse things. Right now, we'll just talk about what we got last year in the 2024 project. So we released the data from this biennial survey project in 4 different reports. So we have the main health center salary and benefits survey report. So we released this one last September. There's a print version and an electronic version. Anybody who submitted data for the report, for the survey, received data regardless of CHAMPS membership status. And anybody who is a CHAMPS member also received an additional print copy of the report. And then there are electronic only companion reports. There's 3 of those. So the workforce metrics report came out in October last year. Provider productivity expectations report came out in December. And then the most recent clinical staffing report was just released this past February. But every 2 years, the whole survey process begins with planning. So CHAMPS convenes an advisory committee of HR and workforce-related staff at our Region 8 health centers and PCAs. And we do that late during the calendar year prior to a new round of data collection. And this group of people, identify potential quality improvements to the survey tool and to the instructions. And I'll talk about improvements from 2024 in just a minute. And so I would just want to throw out to the universe a huge thanks to all of the people who sit on this advisory committee every 2 years, because your input really makes sure that the information report is the best possible information for all of you. So the 2024 planning process created some survey content updates that will impact our discussion today. There were also some other changes in terms of formatting and logistics and filling out the survey, but we're not going to talk about those. So first, the list of job titles that was presented in the survey and then later in the final salary and benefits report had been updated. We'll look at those specifics in a minute, but updates came from input from our advisory committee, the actual data that was submitted in 2024, and then any emerging workforce issues or trends that we may have noticed. And then we worked on new and updated job description summaries to match the updated list of titles, because we have 2 main goals. We want you all to report the employee data under the most appropriate titles, and then we want you to refer to the most appropriate titles when using the report. We also made 2 updates within the expanded benefits section, which I'll talk more about in a minute, but we added a question to gather information about the FTE threshold or requirement for staff in order to qualify for benefits. And then we also asked you to list any additional types of leave that your employees might receive in addition to the typical PTO, vacation, sick, etc. And again, I'll get into more details in a bit. The advisory committee also updated how we asked several of the provider productivity expectation questions to hopefully reduce confusion and ensure we're getting the most appropriate information back from participants. So again, I'll point out the impact of those updates as we go through the presentation today. So now let's look at the new titles that were included in the survey and those that we ended up in the report based on submitted data. So we have 3 new titles: coordinator, manager, and director levels for quality improvement in the survey. There was also 3 new titles: coordinator, manager, and director for risk management and compliance. And this was based on a decision to change an old title. We used to have a title for coordinator, manager, and director for quality improvement / assurance. So it kind of combined the QI and the risk. And so the advisory committee decided to split those out into their own unique title groups. And then we also added a new clinical title for assistant behavioral health. So those 3 were new in the survey. And then based on what you guys all reported, we were able to pull out some people that were reported under other titles and in various places within the survey to create some additional titles in the report. So they weren't in the survey, but we have a director revenue cycle this year, director communications and marketing, director maintenance and facilities, and optometrist. So we will, the next time we have an advisory committee, we'll consider whether or not we want to create a new survey title for each of those. So when you are in your salary and benefits report, which we'll really jump into in a minute, that's where you find the job description summaries that correspond with all of the titles in the survey and in the resulting report. Again, our ongoing concern for the project is making sure that health center data is as close to apples as possible. So we want to make sure people are reporting in the best title and referring to the best title when using the aggregated data. So the summaries provide very short details about typical or preferred information for each title, which we'll look at in just a minute. And our survey also has defined levels for many titles, since what is a coordinator titled employee at one organization can be very different than what a coordinator might be at a different organization. So we want everybody to make sure you know which one of those kind of hierarchical titles you should be using for your different people, even if it's not an exact match for your specific title. So these standard levels are first step at reporting data and should be used thoughtfully when referring to the final report as well. Now, here you see a couple of job description summaries in the 2024 salary and benefits report. So these summaries include typical core duties, supervisory and budget responsibility, and preferred education experience and licensures or certifications. You guys know that a job description is much, much bigger than what we're showing here. We are just showing a quick summary of the key information to refer to figure out where to report and where to refer to when you're using the data. All the information is typical or preferred. Each health center is different, and our goal is to help you pick the most appropriate title, the best fit for your organization. Probably not a perfect fit, almost never a perfect fit, but the best fit for our purposes. So each title includes the pages in the report where you can find data for that title. So that's kind of the index for you. And the section lists only those titles that make it into the report. So there may have been some titles in the main survey that didn't have enough data, didn't have at least 5 data points. And if we didn't have at least 5, we couldn't report them in the final report. So in the report itself, the job description summaries include only those titles that were in the report. And if there weren't 5 data points, we moved them into some sort of other title for the purposes. We didn't delete any data, we included it somewhere else. So we're going to jump into some details about participation in the 2024 project. We had 50 participating health centers across the region, which represented 79% of the organizations at that time that we were collecting data. So the top portion of your screen shows you the number of participating health centers for each project year in green, and in orange you can see what that represents as a percentage of all health centers that were eligible to participate. And then on the bottom half of your screen, you can see some 2024 specific information. So first on the left is the number of participating health centers for each Region 8 state this year. And then at the right, what that represents as a percentage of all health centers that were eligible to participate. So even though there may be some low individual numbers in some of our states, you'll often see that that translates into a high participation percentage for that state. So one limitation to the data that we'll look at today is we never, ever have 100% participation regionally. So the comparisons from one report year to another report year will be with data from slightly different groups of organizations. In March or in 2024, we gathered data for about 6 weeks, beginning in mid-March, and then we did have allowances for limited deadline extensions and a little bit of extra time for cleaning up data, which we will talk about a little bit more in just a bit. So as I mentioned, our advisory committee helps us update the survey and how it's designed and presented to health centers each year, making adjustments to what that survey includes. And then CHAMPS, again, with input from our advisory committee as needed, makes adjustments to how the data is presented in the reports to best serve your needs. So this is a quick overview of the most significant enhancements to the 2024 salary and benefits report. So we updated our category divisions for budget size breakdowns and size by the number of sites. And we'll talk about that in a minute. We had new titles included in a variety of places. So in the overall salary and benefits list for all titles, but also some new titles in our leadership breakdown tables, some new titles in our support staff breakdown tables, some new titles in some of our base salary and total compensation comparison tables. There are those new details about the FTE thresholds or requirements for to qualify for benefits. And then there's new details about the additional type of leave. So we talked about how there were new questions in the survey. And so now there's new sections in the report as well. And we'll talk about these more as we get into the report in the presentation. So your salary and benefits report begins with an interactive or clickable table of contents. We're not going to talk about it here, but if you're in the electronic version, just click around. And then it moves into an executive summary, and that includes an introduction, which includes details about overall participation. It includes details about our methodology, so how we coordinated with the state partners, what data we asked for, when the data was collected. And then it also provides an overview highlighting key figures from each section of the report. So it's a great place to start to get an overview of what's in the report, but then also note there are additional highlights throughout the entire report as well. So look at the beginning, but then look at each section as well. I'll be giving other highlights throughout the day today, but as a high-level overview, in 2024, the 50 participating health centers reported over 780 million in wages, so that's base pay and additional pay, over 90 million in benefits, so that's specifically employer contributions to health, dental, vision, life, and disability insurance, and then employer contributions to retirement and benefits plans. And overall, you all reported over 11,000 employees. So just as a comparison note, and we'll talk more about this later, this equates to an average spend of over $78,000 per staff person region-wide. All right, so we're going to start a little bit more about the executive summary. It also gives you breakdown information about all the participating health centers. And so the breakdowns you see here are also used when we're providing breakdowns of salary and benefits data further into the report. There's also a list of the names of all of the participating health centers by name in case you're interested. So the survey, you may remember, asks a series of organizational questions. So the responses are a few of the items we use to create these profiles. So we create the budget ranges, the number of sites, the location of the sites, and then we also use data reported in the salary and benefits form to calculate FTEs and the total number of employees. So you'll notice that one of the characteristics sort of expressed here is the capture of small, medium, and large participating health centers in a number of ways. So there are 3 annual budget ranges, and so for 2024, those ranges for small are less than 15 million annually. Medium is 15 million to 34 million annually, and large is more than 34 million annually. So we adjusted the levels this year to make sure there was a good distribution of participating health centers in all of the various levels. And those levels have been adjusted many times over the years because your budgets keep growing. So if we want enough data in small, medium, and large categories, we have to adjust those levels. We also look at health center size by number of health center sites. So both administrative and service sites and mobile sites. So all of those go into the numbers. And this year our breakdowns were 1 to 4, 5 to 12, and 13 or plus. And again, we have to adjust those levels for small, medium, and large occasionally to make sure we have enough data. And then we look at number of employees, the number of FTEs as well. Another characteristic we use for creating breakdowns of the data is based on the location of the participating health center sites. So that's a combination of the locations for the various sites reported by each organization. We don't necessarily know how that corresponds with the employees because we don't know where each employee works. But an urban organization has sites only in urban areas. An urban rural organization has one or more sites in urban areas plus one or more sites in rural areas, etc. So you can kind of see how we come up with our breakdowns. So we're going to leave the executive summary, jump into the actual employee salary and benefits data in the report. This here gives you a look at the various items in this portion of the report, and then we'll walk through each of these individually. But before I jump into the data, I wanted to go over with all of you what we asked the health centers report for each employee in 2024. We wanted details for all currently employed employees, so full-time and part-time. If you consider them an employee, they were currently working for you and were being paid, we wanted you to enter their data. We asked for annual data for each employee's full-time equivalency, their salary, base salary dollar amount, and additional pay, and the benefits dollar amount. And sometimes this meant that the person completing the survey would have to calculate up for a full year, and the survey instructions provided details about how to do that. So for pay information, we asked for separate figures for base salary and additional pay. So the annual base salary, their base pay, but not including parking reimbursement, continuing education pay, dues or licensure payments, relocation costs, not including additional pay, etc. So just your base salary. The additional pay, we wanted specifically the amount of bonuses, incentives, differentials, or overtime. Again, not including those additional kind of benefits, things like parking reimbursement, continuing education, dues and licensure, relocation, etc. And we also asked if you were going to be reporting additional pay, we wanted you to tell us what it was for and breakdowns if you were able to do so. And then for the dollar amount of benefits, we wanted you to report for each individual the annual employer contributions to health, dental, vision, life, and disability insurance, and the retirement and pension plans. As many of you know, we then do a lot of data review and cleaning and updating to make sure we have the most reliable data possible. So this is the processing part of the methodology. We contact you all to verify the FTE listed, to verify the dollar amounts listed, if they look like they might be a little questionable. We ask about missing information, things like the employee's level of educational attainment or their credentials, any missing dates of hire or that have been entered incorrectly, so we're not quite sure what the correct date of hire is. Information about who's on your executive team. And then we upload the data to our database, and the base salary, once everything's uploaded as is, the base salary and benefits dollar amount data is equalized to 1.0 FTE. So for example, if somebody actually works half-time or 0.5 FTE and earns $20,000, CHAMPS in our database equalizes that data to 1.0 FTE or full-time at $40,000 for that person. And then we use those equalized salaries and benefits to create the averages and percentiles for each title. After we upload the data, we do additional data checks and reviews. We're looking at the range of salaries reported for each title to identify outliers. We look for anyone reported at an annual salary that would be less than minimum wage. We look at top end salaries to look at what might be out of whack. We also take a look at positions reported as other, so under other clinical or other administrative, and then we determine if anyone can be moved around into an existing title or if we could make a new title. That really helps us, again, like we talked about before, identify titles that might be considered to be added for a future survey year. And then, as I've mentioned, we want to make sure there's at least 5 reported data points for each title so we can move folks around if we need to do that as well. So I accidentally pushed the wrong button. Sorry about that, people. Hold on. Now I have to get back to where I was. I apologize. I hit the wrong button. So really, this is a very simplified view of what is really a huge amount of work that goes into the data cleaning, validation, and preparation process. So if you have any questions about how it works, please feel free to reach out at any time. So now we actually will jump into the actual salary and benefits data that is presented in the report. It starts with a data overview section that provides information about things like the largest groups of employees in the year, the highest paid groups on average, the highest benefits as percent of salary on average. We also provide that for Region 8 as a whole, which you see on this slide, but it also provides it for the 3 different budget breakdowns. There's also a page showing the definitions for various terms used in reporting the salary and benefits data for your reference. And then we have lots of data tables, lots and lots. So the salary and benefits tables in sections C through G are based on aggregated base pay only. And then in H, we have some comparison tables. The first 2 are base pay only, but the third is a total compensation data table, which combines base and additional pay. And not noted as on this slide, but there's a separate section about additional pay that we'll also talk about in a bit. It's also important that you know what kind of data you're looking at when you're reviewing data from various sources. So the CHAMPS data is averages, they're averages and percentiles for all incumbents. So all individual reported employees. This is a more robust group of data to work with. A lot of other reports or data sources present raw or simple averages, which are an average of company averages. So for example, somebody might submit, on average, all of our family practice providers earn X. And so then they'll take that those averages from each company and average them all for a raw or simple average. So by doing all incumbents, the all individual reported employees, you get really robust data from CHAMPS that allows more nuance than you would get otherwise. Again, we don't have time to walk through all the data. There's too much, but I want to make sure you know how it's presented, what to refer to, what it means, and then we'll look at some trends. So right now you see a snippet of the format we use to present data in the main list of all administrative and all clinical titles in section C of the report. So you get a count, the total number of employees reported under a title. You get actual FTEs, which is usually lower than the count because some of the people are part-time. You get various percentiles for the salary reported, an average or a mean for the salaries reported, the average of the benefits reported just for those categories we mentioned earlier, and the average benefits as a percent of the average salary that is listed. So in this example, for the 44 total Region 8 accountant employees, health centers are contributing the equivalent of 18.53% of the average salary for the title in benefits for the employees. Percentiles, hopefully you all know this, but a percentile is a point within the data sets of the annual salaries equalized up to 1 point FTE and sorted from smallest to largest. So the 10th percentile splits the data into 2 pieces. The lower piece contains 10% of the data and the upper piece contains the remainder of the data. So the 90% above it. If you see repeated figures in different percentile places, it's either a very small data set or it's a title without much variation. So sometimes physician residents all have exactly the same salary, and so there isn't much variation in the percentiles. You already know this, but hopefully the 50th percentile is the median. It's the point right in the middle. And then the bottom of this slide shows you a quick overview of additional breakdown tables providing more granular information about some of the selected titles. So we'll walk through that together. But the place to look for all of the titles everywhere is in these all administrative and clinical position tables. So tables 5 and 6. We're going to talk first about leadership and clinical team titles. So it's just a quick view of the titles that are included in the breakdowns for administrative leadership, clinical leadership, and the clinical team, so providers of various sorts. And we were able to include 4 new breakdown titles this year within the administrative leadership group. 2 are because we finally had enough reported data to include a breakdown, so the other HR and other IT director titles. And 2 are because they were new titles in this 2024 survey, so the QI director and the risk and compliance director. So those are new. I'm going to go quickly because this is just a reference back for you. And then when we do these data breakdown tables, what do they look like for the leadership and clinical teams? So for each title, we'll give you averages and medians for salary and benefits data, as you saw within the main data tables, but we don't include the other percentiles. So you will also see the average years employed, which is not a metric that was in the main data table. So that's a little bit newer. And then all of the data is broken down by various organizational characteristics like budget range, location, number of health center sites, number of employees, number of FTEs, and by various individual employee characteristics like the number of years employed and whether or not they're a member of the executive team. So the main salary data tables of all of these administrative and clinical titles present the 3 main budget breakdowns, and those related figures are repeated here in the top of each of these individual title breakdowns as well. But then when we have enough data, we're also able to provide an extra breakout for the extra large organizations. So in this year, that's a 64 million or above. So sometimes you can see what the extra large is a little bit different. And that was based on a request from a member several years ago. So if there's something you would like that would really help you, let us know. We may be able to add it to the reports. There are some additional breakdowns in a couple different places. So clinical leadership, we do breakdowns by credentials. So what does it look like for MD versus DO or NP versus PA? So the participating health centers were asked to report the actual educational credentials held by the employees reported under any of the clinical director titles. And then when you refer to your report, you will see differences in the salary levels for those different credentials. And then for the clinical team tables, so non-director providers and advanced practice providers. So for the purposes of our report, we say provider for a doctorate level clinician, and we use advanced practice provider for typically a master's prepared clinician. And we definitely see some trends for a couple different things for these providers. So first, by time worked. So are they employed full-time or part-time? So for what you see on the slide here, we're matching the federal definition for what is full-time or part-time. So full-time is 0.875 FTE or above. And so you can see an example for nurse practitioner. Remember, we are equalizing all this data. So all the part-time data has been equalized up to full-time, but then when you compare it, you can see that typically we're paying our part-time people at a little bit of a higher rate than we're paying our full-time people. And then for dental hygienists, each of our state is very different in terms of the scope of practice, the allowed scope of practice. So based on this resource from the Oral Health Workforce Organization, you can go in and see what is a narrow scope of practice, moderate scope of practice, or broad scope of practice. So depending on where you are and how much you're allowing your dental hygienists to do, we do see, again, differences in those salaries. So of course, other factors are also in play. All of the other items on the breakdown sheet, your years of service, your size of your organization, your location, et cetera, et cetera. So we're going to do a quick poll. I'm going to let Kayla run this while I take a quick drink. Kayla, can you walk us through this poll, please?
Yes. You should see this poll on your screen now. Which type of salary breakdown do you find to be the most useful for leadership and clinical team titles? And feel free to just choose one. I'll wait a couple of seconds. All right. So it looks like we have most folks participated. So the majority of them said other, and then one person said I use multiple breakdowns.
Great, thank you. I actually would be very curious to hear which of the other breakdowns you're most interested in. So go ahead and throw that in chat and I'll take a look at it later. I love that. Okay, so let's move on. The report then goes into limited salary and benefits breakdown information for administrative and clinical support team staff members. So the 2024 titles are listed here, and you can see an example of what it looks like, what the table looks like. So when determining which support staff titles to provide breakdowns for, we look for those with the largest groups of employees across the region. So typically those with around 100 or more reported employees. So we were able to include 2 new titles this year based on the amount of data that was reported. So the administrative janitor, custodian, housekeeping title is new to this report, and the clinical behavioral health assistant title is also new. We only provide the years of service breakdown for those support positions. So as you can see, we look at less than 5 years, 5 to 9 years, 10 to 19 years, and 20 or plus years. And then there are 2 exceptions where we provide additional data. So for coder, we provide additional coder salary data based on if the employee held some sort of certification or not. And then for the case manager data, we provide a breakdown of the credentials held by each employee reported, because case managers can have a high school diploma, they can be an MA, they can be an RN, et cetera, et cetera. So we'll provide breakdown of the case manager data also by the credentials held by the employees that were reported in that section. The report also provides a couple of ways to compare the 2024 Region 8 Health Center information with other available data. So first, we compare our 2024 Health Center data with the CHAMPS Health Center data from prior years. So we have 2 tables presenting all of that information. So it's an alphabetical list of 100 of the year's titles. It doesn't include any of the other groups, because other is kind of sometimes is a mismatch of people of all reported together. And then you can see at the bottom of the slide, we were able to add 5 new titles this year because we had enough data over multiple years to show trends. So the tables provided data for the entire region and also for each of the 3 budget levels. They show medians for 2020, 2022, and 24, and then percentage change within the sections of those 3 years. If there's any asterisks you see, that's because there weren't 5 reported employees in that title for that year. So when you're looking at these and looking at the comparisons, we want you to note that there are sometimes comparability issues from year to year. So remember that there are different budget breakdowns methods for the different years. Just because you guys are growing all the time, so what is small or medium or large is going to be a little bit different because the cutoffs are a little different each time. And then remember that the group of reporting health centers is not exactly the same from year to year. So the report also has a couple tables comparing Region 8 Health Center median salary data with information from other state, regional, and national data sources. We have heard loudly that you want comparative data. It's hard to find. And so here is where we're giving you some of that comparative data. So we'll start with the table providing comparisons of Region 8 base pay data with data of other organizations. So not considering any additional pay. We have some health center specific comparisons. So some with Region 8, along with Colorado Community Health Network, specifically for Colorado, NWRPCA, so specific for the Northwest region of Alaska, Idaho, Oregon, and Washington, and NAC, so some national data. So we don't see them on the screen, but they're also in the table for this. And then we also have information from other industries. So in this case, we have one Associated Employers, and then we also have US Bureau of Labor Statistics. So the tables include fewer selected titles. It's usually administrative and clinical leadership, some of the clinical team, and limited support positions. So the titles are selected based on what seems to be the most useful, as well as what is available through other data sources. So when you're looking at comparative data from other organizations, we want you to be clear on what the data is and whether or not it actually is comparable. So for example, is the aggregated data, is it all incumbents? Is it that raw simple average? What data is considered, what is considered as part of the base pay or additional pay or total compensation? And so CHAMPS has footnotes in the report to help you understand exactly what is being looked at. So then next in our report, we'll talk a little bit about, hold on, I'm going to go back up one. Yeah, so we had the base pay table that we were talking about, and then the next one, we also have a comparison table for total compensation. So total compensation is base pay plus additional pay. And so for the CHAMPS and the NWRPCA data, this is only for full-time employees because we're not really sure how to equalize additional pay. So it gets a little bit weird. So we take the full-time employees and do a total compensation, which is the base pay plus additional pay, and come up so we can create some medians for you. Then the NAC data you'll see is salaries, salary bonuses, and other incentive payments. In this table, we also can get data from MGMA that we have purchased for some specific titles. So that's looking at wages that are either contracted and on-call, but also bonuses, incentive payments, research stipends, honoraria, and different distributions of profits. So you'll be able to see that when you look at the footnotes. Just so you know, in 2024, we have been able to reintroduce NAC comparative data. We didn't have that in the past. Well, we had it a long time ago, and then we weren't allowed to utilize it as a comparison point, and we have been able to add it back in. So NAC comparative data is back. And then also, we have been able to add a line in this total compensation report for psychiatrists that we didn't have before. So one of the things you'll notice when you're looking at all of the comparison tables for base pay and total compensation is that our Region 8 salary levels are typically a little lower than what you'll see in the Northwest. Although, if you think about it, on average, the cost of living is also lower in Region 8 than in Region 10. And then our Region 8 numbers are also lower than the U.S. Bureau of Labor Statistics and the MGMA figures, but those figures also include a wide variety of for-profit organizations. So then let's talk about additional pay. We'll come back to this. So what we used this is what we used when we were calculating that total pay on the previous slide, the total compensation. However, this additional pay section uses all of the reported additional pay data for both full-time and part-time employees. So 86% of our participating health centers in 2024 reported additional pay for one or more of their employees, which is up from just 64% of participating health centers in 2022. Almost 33% of employees were reported in the salary survey in 2024 earned some sort of additional pay, and that's up from about 21% of employees in 2022. And for those earning additional pay, the additional pay overall represented 4.2% of their actual unequalized base pay. For those same employees, which was very similar to 2022 at 4.3%, which I thought was interesting. So just remember that annual additional pay was to include bonuses, incentives, differentials, or overtime, not parking, not continuing education, not dues or licensures, not relocation, etc. So if you go into the report, you'll see a lot more granular details on those individual types of additional pay. We also give some additional highlights, and we've provided a few here on your slides. So the highest dollar amount of additional pay per employee, on average per employee earning additional pay. So only, for example, only considering the OBGYN physicians that earned additional pay, on average, those earned over $35,000 more per year in additional pay. And so you can see how that broke out. Then we also looked at the titles where additional pay made the biggest difference between base and total compensation for those full-time employees. So when we looked at putting everybody together, the family practice with OB physicians, they made the biggest difference there. When we looked at, for the full-time employees, the difference between the average base pay and the average total compensation, so based on additional pay, there was almost a 7.5% difference. So just things that you might consider when you're looking at how you are compensating and making sure you're thinking about all the different areas and how to be competitive. Now, the information you see on the next couple slides is not in your report, but I thought it'd be really interesting to look at some 2022 to 2024 trends. So you may remember that we talked about a total spend figure way back at the beginning of this process. So the total spend in 2024 was about $78,500, and that was a little bit increase, a 4.9% increase from 2022, where the total spend was 74,875 per employee on average. That included a almost 9% increase in average wages figure. So for the wages, that's base salary and additional pay, not including benefits. So you can see that included that increase there. But what we thought was interesting is we look at the average benefits earned just for the employees earning benefits. We saw over 15% decrease between 22 and 2024. So in an interesting sort of workforce environment, I'm sort of guessing that folks saw a need to increase salaries to maintain competitive, but then it's potentially possible that benefits needed to take a hit in order to compensate for that. So just kind of an interesting things we were seeing. And then looking at the historical base salary growth in Region 8 for selected title groups. So the next slide will show you all of the individual titles that were included in each of these categories. It's not everybody, but just some selected folks. The green shows the growth from 2020 to 2022. And then just remember in 2020, folks were submitting data at the very beginning of the pandemic, so it had just barely started. And so there weren't many pandemic related changes in the original 2020 data. And then the orange shows the growth from 2022 to 2024. So some of the things I think are interesting on it is that we saw, like if you look at our provider area, and this again, doctorate level providers, so medical, dental, behavioral health, doctorate level folks, we saw very little change between 2020 and 2022. And then we saw a big change between 2022 and 2024. Was it because providers are contracted and it took a while for some of those changes to be reflected in their contracts? Potentially. I also see a big increase recently for administrative leaders, which I find interesting. Clinical leaders was down a little bit. So just some interesting discussion points when you're looking at this data. And then this is the fine print slide, so you know which titles were included. So when you're looking at those changes and averages on this slide, these are the folks that were included in those figures. All right, so that was a lot of salary data. It is great. I have a lot of time. I'm jumping in to the benefits packages section of our report. So looking at health center benefits packages, this information is not based on the salary and benefits amount reported for individual employees, but instead on a separate portion of the survey tool that asked for details about health center policies for different benefits. We wanted you to report it for only eligible employees, and you reported it by staff type. We had a new question in 2024, you may remember, that asked about the FTE threshold or requirement to qualify for benefits. So how much did somebody have to work in order to qualify? So we had, it ranged anywhere from 0.5 FTE up to 1.0 FTE to qualify for benefits. The average was 0.65 and the median was 0.75. So that was the first year we asked this question. We'll kind of see what we want to do with it from here. And then we jumped into the benefits packages specific to insurance, retirement and pension programs, leave time, and some additional incentives. So before I jump into those nitty-gritty details about the benefits packages, I am going to jump back to some of the data that was in about benefits that was related to all of the individuals, employees that were reported for salary and benefits. So there was over $90 million spent in annual employer contributions towards health, dental, vision, life, and disability insurance and retirement and pension plans overall, and that represented 13.4% of the annual base pay for those same employees. Now note, it's not on the slide, but that's down from 16.4% of the annual base pay for employees in 2022. So we just talked about how we're seeing that kind of shrinkage a little bit in the benefits. So In the insurance part of the benefits package portion of the survey, we asked about your policies for 6 types of insurance: employee health, employee dental, dependent health, dependent dental, employee life, and employee disability. And all of our participating health centers offered and helped with the cost of one or more of those insurance programs per employee. And then we also asked about the retirement benefits packages offered by each health center. So 100% offered some type of retirement or pension plan, which seems logical, but has not always been 100% regionally. And we'll talk more about the retirement plans and stuff in just a minute. So first, let's jump back to insurance. We're going to take a closer look at the insurance information. So this graph represents employer contributions to insurance. So in dark blue, we have a plan with, we call it full coverage. And what that means is the health center offers a plan to employees and covers the entire cost of the benefit for the employee. So the employee gets that insurance and doesn't have to pay anything. If it's a plan with partial coverage in red, that means that the health center offers a plan for something and covers some portion of the cost of the benefit for the employee. So there's some sort of premium share for that plan. And then in green, if there's a plan with multiple coverage options, that means the health center offers a plan. And then for some employees, they may cover the full cost. And some of the employees, they may require a premium share, or some of the employees, they may not provide any money towards the cost. So some multiple types of coverage based on different employee groups. In purple, there's a plan but no coverage, which means the health center offers a plan but does not have any employer contributions to the cost. So employees can sign up, but they have to pay for it all themselves. And then no plan in yellow means that the health center doesn't even offer that related insurance plan. So you'll see here that our health centers were most likely to offer access to employee health insurance. So here on the far left, you see the column, and there is no yellow for no plan. So this is the one they're most likely to offer to everybody. And in 2024, our health centers were least likely to offer employee disability insurance over here on the right side. So there were 10% of our participants did not offer any plan at all. We also asked for some additional information about health insurance for those health centers that reported partial coverage, meaning there was some sort of premium share. And so for those, if there was partial coverage, we asked about the percentage of employee premium that was covered by the health center. So on average, for people who had partial coverage, they provided 80% of the coverage for employee health insurance and 66% of the coverage for dependent health insurance. So hopefully that gives you an idea about how your insurance packages compare with some of the other health centers. And again, more details are in the report. Now we'll go back to retirement and pension plans. So we ask about the types of plans you provided. In 2024, 401ks and 403bs were the most popular, but there's lots of different types out there. We asked about the average maximum employer contribution to the employee plans. So that is, you may offer 3% for some employees and 5% for other employees. So we looked at the maximum amount that you would contribute. It ranged anywhere from 0 to 14.9%, 14.9% of the employee's annual wage. And we came up with some averages. So 5.2% of the annual wage was the average maximum employer contribution, not necessarily what you are contributing, but based on your policies, what the maximum possible would be. We asked how you contribute to your employee accounts, and the most common way was a match. So the employer contribution matches exactly or some in percentage of what the employee themselves is contributing. So almost half of the health centers were doing a match. And then next, the employer, there's employer contribution regardless of what the employee does, plus some sort of match. And so just about 16% of you did that. We also looked at vesting schedules. So when do employees have access to the health center, to the employer contributions to their plan? So the most commonly was immediate access. So it's when they're in their plan, they have immediate access to what the health center is putting in. That was just over 40% of you. And then the next highest was a 3 to 4 year vesting schedule. So like a 4-year vesting schedule would be after 1 year. you have access to 25% of the employer contribution. So after 2 years, you have access to 50, 3 years, 75%, and then at 4 years, you have the full access. We also asked our health centers about 6 different types of paid leave. So we asked for the average number of hours employees could earn annually for vacation, sick, personal, or PTO bank time. And then we asked for the average number of days allowed for holidays and floating holidays. The most common combinations of leave reported by our 2024 participating health centers was PTO time and holiday time. So 22% of our health centers reported offering just those 2 types of leave. So we kind of watch over the years where are people relying more on vacation time or PTO bank time, and it kind of changes. And then there have been some state-specific regulations that are kind of changing things too. But so then you can kind of see what people are offering. Then the leave time that you reported was reported as a minimum or maximum. You could earn like X number of hours minimum annually or maximum annually, allowed by your policies. And we didn't want a 0 because it's only for people who qualify for the benefits. So as long as they qualify, they're earning something. So what is the minimum and the maximum for leave within each of these categories, and then for each of the 6 staff groups, which we'll look at it in just a minute. So we average that information all together to get these figures based on the policies, not necessarily what one person is earning, individuals. And here you'll see the data for all staff combined overall, and then each of our 6 different types of leaves. So the annual allowance for those. So the total number of non-holiday time reported in 2024, which is on average 216.1 hours annually, was very similar to 2022 when it was 217.4. So not a lot of changes over the last 2 years. And then note that in 2024, our survey asked for other types of leave time that you may provide that aren't included in the types you see here, and we'll get to that information in just a little bit. So now you see the average annual averages of non-holiday hours. So we're not considering holidays or floating holidays right now for each of the different types of staff. And so we have administrative leadership, administrative supports, providers and advanced practice provider staff, total, and then broken out by medical, dental, and behavioral health, and then clinical support staff. And you can see there isn't that much of a difference between the individual staff types, but it is lower for the 2 support staff categories. And then the last thing we asked about in this kind of benefits packages section was about 8 different types of additional incentives. So as you can see here, payment of licensure, professional association dues, continuing professional education, et cetera, et cetera. So this table tells you the percentage of participating health centers that had that type of incentive allowed in their policies and the average dollar amount offered overall by that policy for each type of incentive. So a little bit about bilingual. We don't have an average dollar amount allowed for bilingual because sometimes it's a set amount, dollar amount, and sometimes it's like a percentage of salary. So it's hard to come up with an average. 98% of our health centers reported offering 1 or more of these additional incentives to employees. And one of the other things we asked was also about the hours per year allowed for continuing education. So 90% of our health centers reported for this particular item, and they allow 37.7 hours per year on average for continuing education overall. We also go into kind of breaking out what those dollar amounts look like for different types of staff. So you can find this table in your report as well. So our providers, medical providers and advanced practice providers, dental and behavioral health providers on our top 3 lines. And you'll notice that they typically qualify for larger amounts than the other staff groups. And the medical providers typically qualify for more than the dental or the behavioral health providers. So again, hopefully all of this benefits package information helps you assess what you're providing for your health center, for your staff at your health center, and how you kind of compare when you're looking at benefits packages overall. The CHAMPS report on salary benefits also includes a look at your plans for a salary increase. We saw a big increase of the percentage of health centers planning for a salary increase back in 2022, and now in 2024, that's dropped a little bit. Also, as I mentioned earlier, the 2024 survey included a new question asking folks to report other types of leaves that they provide for their employees. So the most common additional types were this bereavement leave and jury duty leave, but then there was also education leave, extended illness leave, military leave, parental leave, etc. We did not include state-specific like FMLA and any state-specific similar items like a family in Colorado when we were looking at these additional types of leave. Again, this was a new question in 2024. So part of what we'll be doing with our advisory committee is deciding what we want to do with this information. Where do we go from here? So we'll take that into consideration soon. And then there has, for several years, been an extra question about what other kinds of benefits do you offer to your employees? So here's a quick list of all the different things that you guys were saying you also provide. So anything from bus passes, there's Flight for Life, ground transportation coverage I thought was really interesting, wireless and cell discounts and reimbursements. So just a quick look at some of the other stuff that sometimes you provide to help with your employees. All right, that was a lot. We're done with salary and benefits. Yay, good job, everybody. We're going to jump into our 3 companion reports that we provided, and we're kind of doing them based on when they were released this year. So our first companion report is the Workforce Metrics Report. It's typically released very soon after the Salary and Benefits Report. All of this data was originally part of that Salary and Benefits Report, but in order for us to get the salary data out the door as quickly as possible, we moved the workforce stuff into its own separate report. So this companion is electronic only, and it includes the introduction to methodology like we talked about before, a section of overall highlights, which again is a great way to get a quick introduction to the stuff that you'll be reading about in the report. And then it moves into recruitment, findings, trends and needs, retention, findings, trends and needs, and a little look at health center workforce demographics. So let's start with our recruitment related metrics. Those of you who have taken the survey may remember us asking you all to identify which positions have seen challenging recruitment over the past 12 months. And we didn't tell you what challenging meant. We let you determine what challenging meant to you. So we were looking at it each year. We look at the average number of positions that were considered challenging for our health centers. So this year in 2024, the average was 5 positions were challenging, had challenging recruitment. That's compared to 5.6 back in 2022. You all reported more challenges recruiting clinical positions than administrative positions. And the most identified positions that were challenging in terms of recruitment were dentist and medical assistant, followed then by dental hygienist and registered nurse. The report, not on your slide here, but the report also looks at the top positions that were identified as challenging by budget size and location. So for example, MA was the top for small budget organizations, while dentist was top for mid-budget and non-urban mix organizations. So health centers with no urban sites at all. And then dental hygienist was top for big budget organizations and the urban mix organizations. So organizations that had 1 or more urban site. We also had a point in time vacancy survey, which asked you to report the executive or director level, doctorate provider and advanced practice provider positions you were currently advertising for. So not including any other vacancies, only the ones that you were advertising for. We looked at the average number of vacancies per reporting organization over time. So you can see a slight drop in the 2024 data compared with 2022. And the openings you reported were mostly doctorate level providers and APP. So as you can see here at the top, doctorate level providers and APP, so not very many of the executive and director staff. And the openings at the bottom, you can see we're looking at them broken out by administrative, medical, dental, and behavioral health, so different clinical disciplines, so mostly medical, and that percentage has been growing from 2022 to 2024 in its representation of all vacancies. And then for each opening, we ask you if it's something that you continuously recruit or not. So If you have a PA opening, and as soon as you fill that PA opening, you always have another PA opening to fill, that's continuously recruited, right? It's open all the time. For those that are not continuously recruited, which means you hire somebody and you can take that posting down, we ask for the current length of recruitment, and realizing that that's the current length of recruitment, that's not the total length, because most of these you haven't hired anybody yet, so it'll be open a little bit longer. So for those that aren't continuously recruited, we asked for a current length of recruitment, and you'll see here it was highest in 2024 for our doctorate level providers. So 6.0 months was our average for the current length of recruitment in 2024. You can see that's been growing over time. And then we look at the by discipline over here, and you'll see a big jump in the dental as well. We also asked everybody to identify which position was their highest priority to fill. And so most of the highest priority were for physicians. And then also there was a decent representation with dentists in there as well. Now, for the past 3 rounds of this big all-employee even year salary survey, we've asked a question about whether or not you use recruitment firms. So you can see in the header here that for 2024, the people who said yes, they'd use recruitment firms or consultants, spent an average of over 130,000 in the past 12 months, which is up from the 2022 reported level of just over 52,000. You can see that we are increasing all the time in the percent of health centers that say they are using recruiting firms. And then at the bottom, you can see a pretty diverse group of disciplines that you are using them for. So mostly medical, but also a decent amount for dental and admin, but also for behavioral health, lab, and pharmacy. And then you look at kind of the level of people you're looking at. Most of them are that doctorate level providers. So those could be dentists, physicians, psychiatrists, et cetera. But then also a pretty decent amount for administrative leadership. So we're kind of following that over time. So next, we're going to switch over to some retention metrics and trends, starting with some tenure. So the report section details tenure figures for all titles individually. We're just going to look at some highlights today, and we use it based on the date of hire that you reported in the salary and benefits section of the report of the survey. So in 2024, this is for all 11,089 employees, and you can see that our average years of service has been pretty steady from 2020, 2022, and 2024, but we're seeing some slight decreases in the median. So out of all your employees, at the very middle of all the employees combined, though that person's been there for 2.7 years. But when you average them all, because we've had some people who have been here a really long time, the average is 5.0 years. So you can also see the medians and the averages for just the administrative employees and just the clinical employees. Just so you know, the U.S. Bureau of Labor Statistics median for all employees in 2024, median was 3.5 years. So to compare with our 2.7. We're seeing slight decreases in that years of service for all employees and for both the administrative and clinical groups. The longest employed years of service in our survey was for the executive directors, the CEOs, and the shortest was for dental residents, which makes total sense. Residents aren't around very long. We also then asked you to identify which positions have seen challenging turnover in the past 12 months. So this is very similar to the position seeing challenging recruitment question we talked about several slides ago. Again, we didn't tell you what challenging meant. You decided that for yourself. So we have an average of 3.2 positions per health center were identified as having challenging turnover, so a little bit less than had challenging recruitment. And it is a drop from what we saw in 2022. You have more challenges retaining clinical support positions overall. And you can see the most identified were medical assistant, dental assistant, and reception front desk. Again, we go into some breakdowns in the report by budget size and location. So for example, reception and front desk was the most challenging for the small and mid-level budget organizations and for non-urban mix organizations. So you can go to the report and find some more little details like that. The next thing we asked for everybody to do was to identify the top reasons that folks were choosing to leave your organization. So for top reasons for voluntary turnover, why are they choosing to leave? So better pay was by far the top reason, selected by over 67% of our participating health centers. And just so you know, better pay was also the top identified reason, regardless of budget size, regardless of location. Next up, we have turnover survey. When you filled out the survey in 2024, you provided calendar year 2023 turnover figures. So separations and average number of employees for 6 different staff categories. So if you look down here, we have the all group, all staff combined, clinical leadership and management, clinical provider, clinical advanced practice provider, clinical support, administrative leadership management, supervision, and administrative support. So you'll see on the left that Region 8 experienced a slight drop in turnover for all staff between calendar years 2021 and 2023 to 29.1%, which is lower than what's being reported by the Bureau of Labor Statistics, which is kind of nice. You report your separations separately as voluntary, employee initiated, or involuntary, organization initiated. And we saw a big jump in 2024 for the percentage of turnover that was involuntary for both clinical leaders and look at that number for administrative leaders. That's interesting to me. All right, so then we'll look at a couple multi-year trends in turnover rates for both our 6 different staff groups up here at the top. A little drop for all, but there increased turnover for clinical leadership and increased turnover for administrative support staff over the past 3 cycles of data collection. And then at the bottom, we do actually gather turnover information in our abbreviated surveys. So in the 2023 abbreviated survey, we gathered 2022 turnover data. So this is 2022 to 2023 turnover data for discipline-specific areas of the clinical stuff for medical providers, dental providers, and behavioral medical health, mental health, doctorate level providers. We see drops in turnover from 2022 to 2023. We also see drops in the advanced practice provider groups for all of 3 of those disciplines. But then when we look at support, we saw drops in the turnover for medical support, but a big increase in dental support, and then also increases in behavioral mental health support and some other clinical and enabling support titles as well. So we like to watch those turnover figures over time. And then lastly, the workforce metrics report takes a look at demographics for your workforce. So you can see that 38.3% of our health centers reported that less than 1 to 3% of their employees were veterans. For minorities, these are minorities as they are listed in the UDS. We see that, for example, almost 50% reported that between 1 and 25% of their employees were identified as a racial or ethnic minority, and the exact inclusions in that group is in the report. And then we looked at whether or not they held a college or other advanced degree. So we see here that 8.5% of our health center respondents said that between 76 and 82% of their employees held some sort of advanced degree. So understanding what our workforce looks like, it can be impactful in terms of comparing it with our patient base, when we're out looking for other grants and things like that. All right. Kayla, I'm going to skip this poll because I want to keep going and get to all of the information. So I'm going to keep moving on. The second companion report was about provider productivity expectations. So this was hopefully to illustrate what the health centers are asking their providers to accomplish, not what they're actually doing, not productivity that you can get from UDS, but what you're asking them to do. So this is as a component of informing discussions about provider productivity in conjunction with lots of other available data. So we have the introduction of methodology and the report overview and highlights again, and then we look at health center expectations for full-time hours, administrative to direct patient contact time, number of hourly visits that are expected to be provided, and then we also look at approximate patient panel sizes. So we wanted you guys to provide this information about your full-time providers conducting on-site services for health center patients. So that can include employees or contractors, and we wanted you to base it on normal in-clinic working hours. So don't include vacation time, CME time, on-call time, hospital time, etc. We included the titles, these director level titles and non-directors, and you provided information for each of them individually. So the first question that people were asked was, what is the average number of hours per week that your full-time medical, dental, and behavioral health providers are contracted for? That's a little different than how we asked the question in the past. It used to be, what number of hours per week does your health center consider to be full-time for medical, dental, and behavioral health providers? So we really kind of tried to tighten this up a little bit. The report looks at the minimum, maximum, median, and average number of hours per week reported for each provider group. And then it also lets you know how many health centers were reported for each title. I'll go into a selection of graphs highlighting data in different ways, but there, again, a lot more details in your report. So the vast majority of our participating health centers reported 40 hours a week to be full-time for all providers. Lowest average was for our psychiatrists, and the highest was for medical directors and then the behavioral health directors. The next question you were asked is, what is the expected ratio of direct patient contact hours versus administrative time hours for your full-time medical, dental, and behavioral health providers? Health centers responded to this question in a number of ways. I have the little asterisk here, but in fact, this question did not change. So I apologize. It's an error on this slide. There was no change in this. But you were asked to include or consider administrative hours to include time not spent with patients. So it could be for supervisory duties, staff meetings, huddles, charting and documentation outside of the patient visit, etc. So in this case, our director level employees were reported higher average percentages of expected administrative time than non-director employees. Our highest was for the medical directors, and the lowest average administrative time was for dental hygienists. And then we also provide some breakdowns of data when we saw trends. So for example, in this case, we saw a trend that the expected administrative time increased for medical directors and decreased for behavioral health directors and other non-director behavioral health providers at organizations that had a high level of behavioral health integration. Interesting. So here's an example of a graph where we compare all of the data for each of the individual titles. So you can easily see here, the blue is the expected administrative time. The administrative time is higher for our medical director, dental director, and behavioral health director titles. So that's just an example of how you'll see some of this data presented. The third question was related to patient visits. So how many patient visits are your medical, dental, and behavioral health providers expected to complete per hour of direct patient care? So considering only visits for individual patients, not group visits, groups of patients. And those expectations were highest for medical providers and generally lowest for behavioral health providers, ranging highest for physicians per hour at 2.6, and then the lowest for behavioral health directors. The expected average visits were slightly higher for most medical and behavioral health titles at highly integrated organizations that has a high level of behavioral health integration. And then the expected average visits were higher for all medical and dental providers at large organizations, so those with annual budgets of more than 34 million. So you can, again, check out a little more detail in the report. So here's a little sneak peek at the breakdown categories for those medical and dental directors, showing you the higher averages at the largest health centers. Fourth question was about approximate patient panel sizes for full-time medical, dental, and behavioral health providers. So in this case, you were asked to consider the approximate patient panel size to be the number of individual patients under the care of a specific provider. And we did update this question. So in previous years, we asked about the standard patient panel size for those full-time providers. And we felt like the standard terminology was being a little bit confusing for people, so we changed it to approximate. The average patient panel size is higher for medical and dental providers than for behavioral health, which is probably not surprising. Largest was for physician assistants and smallest for psychologists. higher at highly integrated organizations for all of the medical and behavioral health providers except medical director. And the largest health centers reported higher average panel sizes for all of their medical, dental, and behavioral health titles. And here is another example table. This time it's kind of showing you the percentage of reporting health centers by panel size, category, and title. So for example, if you look at the dark blue in this table, which stands for less than 250 patients in the panel, you'll see that the behavioral health providers were much more likely to fall within this category. So 83.3% of our participating health centers reported a panel size for psychologists within this less than 250 patients category. So just an example, you'll see similar graphs like that throughout the report. Again, I'm going to skip the interact poll so that we hopefully have time for a few questions at the end. And I'm going to take now a little time now to talk about our third companion report that just came out in February. This one is our clinical staffing report. And again, our goal is to inform discussions about productivity, staffing ratios, adjustments to care teams, et cetera. So using our data in conjunction with a lot of what else you have. So in addition to our introduction, methodology, and overview and highlights, we have staffing ratios, in this case for Region 8 and for individual Region 8 states, looking at administration, medical, behavioral health, dental, and pharmacy staff. We'd look at providers versus support staff, and then we'd look also at the wider care team as well. In 2024, it's the first time we split providers out to provide some more specific, not providers, pharmacy out to provide more specific pharmacy ratios. So that's new this year. In this case, we utilize the FTE data that you reported for all of your employees in the salary and benefits portion of the survey to develop these staffing ratios. And then I have our small print so you understand that the participating organizations reported data for currently employed health center staff only. So it doesn't capture any information relating to vacant positions. It doesn't capture any information about if it's in-center versus off-site time, patient contact versus non-patient contact time, any additional care that might have been provided by non-employees, et cetera. And as a reminder, when you're looking from year to year, those people who reported in 2024 are not necessarily the same as who reported in previous years. So we do have some year trends in the report. So first, we'll look at some highlights overall and for provider-specific data. So in 2024, 40.3% of all Region 8 FTE were for administrative staff. And North Dakota reported the highest percentage of administrative FTE. So in North Dakota, almost 52% of all of their FTEs were for administrative staff. Almost 51% of the clinical provider FTEs were for medical providers region-wide. You can see just about 22.5% for behavioral health providers, 16.7% for dental providers, and 9.9% for pharmacy providers. And in this case, providers are including the leadership, so director levels, it's including the doctorate level providers, and it's including the advanced practice providers in each of those categories. A little state highlight in Wyoming, over 64% of the clinical provider FTEs were for the medical providers. So they had the highest percentage of medical. Region-wide, almost 56% of those medical provider FTEs were for our advanced practice providers, nurse practitioners, physician assistants, certified nurse midwives. And we'll see another slide for a few more highlights in just a second. And then almost 71% of all behavioral health providers were for the mid-level category, the licensed clinical social workers, et cetera. Almost 45% of dental provider FTEs were for dental hygienists. Over 43% of all the pharmacy providers were for pharmacists, separate from clinical pharmacists or residents. In Utah, over 18% of the pharmacy provider FTEs were for pharmacy residents. They had the highest percentage of residents in Utah. So here's an example of how we will take a look at some of these ratios ratios. So the medical director level is in blue at the bottom, and so you can see what that percentage of all medical providers was in Region 8 and overall. The red is for physicians, the green for physician residents, and then the purple for our advanced practice provider group. So you can see that Colorado had the highest percentage of physician FTEs, Wyoming the highest percentage of physician residents, South Dakota highest percentage of advanced practice providers as a representation of all medical provider FTEs, and Montana had the highest percentage of the medical director FTEs. So interesting to look at. And then there's a whole bunch on support highlights, support staff, and the provider to support ratios. So for almost 50% of the medical support FTEs region-wide were for medical assistants, but you'll see in North Dakota and South Dakota, when you look at the report, that those health centers were more likely to use RNs than MAs. Region-wide, the medical support FTE to medical provider FTE ratio was 2.22, which means there were, for every 1.0 medical provider, there were 2.22 medical support staff. This ratio was highest in Colorado at 2.49 this year in 2024 and lowest in Wyoming. When we look at dental, 80% of the dental support FTEs were for dental assistants and sterilization techs, separate from expanded function and a few other titles. So Wyoming reported the highest percentage of expanded function dental assistants, which is interesting. The region-wide dental support to dental provider ratio was 1.25, and it was highest in Wyoming and lowest in North Dakota. When we look at our pharmacy this year, 84% of the pharmacy support was for pharmacy technicians. Again, you can go into the report and see what other titles would file into the support category. For example, Montana reported the highest percentage of pharmacy assistants, separate from the technicians. Just so you know, North Dakota did not report any pharmacy provider or support staff in 2024, so they're not included in any of this pharmacy data. And then the region-wide pharmacy support to provider ratio was 1.34 in 2024. So here's the report gives some trends in those support to provider ratios over time for Region 8 and our individual Region 8 states, and then also breaks down some of the data by size as indicated by the number of sites operated by the health centers and the number of FTEs employed by the health centers as well. So you can take a look at those when you have a chance and those trends over time. Then the last part of this report looks at care team staffing ratios. So looking at medical full-time equivalents compared with the FTEs for various staffing groups and additional titles. And the most available national data comparative. So if you're looking at like patient-centered medical home, it's based on physician FTEs. However, many of our health centers rely on advanced practice providers like nurse practitioners or physician assistants as key components of their medical care team. So we have provided baseline ratios in 4 categories. So we look at care team groups to medical providers as a whole and care team groups versus physician FTEs. We also look at different titles compared to medical providers and physician FTEs. So I'm going to go quickly through those last team. The care team groups are everything we just talked about: medical providers, medical support, dental providers, dental support. We also look at all administrative staff and some other clinical staff. And then some of the additional care team titles that we look at are listed here. And then we'll provide, this is examples of the medical provider FTE, since most of our region, a lot of our region relies on APPs and the advanced practice instead of physicians. We're looking at all medical provider FTEs. So for example, you can see here that the administrative FTE to medical provider FTE ratio increased from 3.12 in 2022 to 3.74 in 2024. Then we also look at different titles instead of just care groups. So you can see that MA, registered nurse, and receptionist, front desk, appointment clerk, FTE to medical provider FTE also increased between 2022 and 2024. So those are some different examples of what we provide there. Lots and lots of data. Go back and look. I'm going to start talking. We only have a couple minutes to see if there's any questions that might be out there. So Kayla, are there any questions either in Q&A or in the chat that we should listen to today?
I do not currently see any questions. but I'll give folks a moment if they would like to put any of their questions in the chat.
Great. So while you guys are thinking about that, the event hopefully will help you understand what's available in all of the reports and kind of pique your interest based on some of the highlights so that you'll use them a little bit more. Reach out to me at any time if you have any questions. And then you'll see some similar features when you get the report for the abbreviated survey that you guys are all filling out right now, hopefully. So if nothing has come in, I'm going to go ahead and say thank you so much. And I'm going to pass it over to Kayla to close us out. Thank you.
Great. Thanks, Andrea. And thanks for everyone for joining us today. The recording will be on the CHAMPS website, and Andrea will email everyone once that recording is available. Please take a moment to complete the evaluation for this event so we can continue to improve how we present this information and how we host events in general. The link is in the chat, and it will also be included in a follow-up email after this event. We would also appreciate it if you could take a few minutes to evaluate both the main salary and benefits report and the 3 companion reports. So there are 2 surveys, one for the salary and benefits report and another for the 3 companion reports. In recognition of your time, you'll have a chance to win a participation prize for completing each of these report evaluations. The links for the evaluations are now available in the chat box and will be included in a follow-up email after this event. As always, you can visit our website, www.champsonline.org, click on Events and Trainings, and there you can find more information about upcoming live and archived distance learning events. Thank you again for your participation in today's event and for submitting your health center's data to this important project. Your time is greatly appreciated. We hope you have a great afternoon, everyone. Thank you again.
Thanks, everyone. It was great to be with you.